So I don't know. But I do believe that if that does happen, it will create, which is ironic. It's like the stock market's gotten so used to insanity and volatility and yeah, we're going to have a trade deal with China. We're not going to have a trade deal. Here's the tariffs. And here's not. To that would kind of be like the pulling away from the craziness would probably not be good. Now, this whole, I'll tell you what really gets their attention. Have you seen these articles about like Medicare for all and what that's going to cost?
For sure. Yeah.
The headlines of 50, was it 50 plus million? I can't remember, 52, 57.
Trillion.
Or right, trillion. Sorry,
Yeah.
Million.
Yeah.
Like,
It's like Dr.
50
Evil.
million dollars. No, 50 million. Yeah,
Yeah.
No, 1 billion. Oh my God, crap! That's a lot of money.
Yeah.
Yeah, trillion.
Yeah.
What was the whole thing? Did you ever see that thing like the difference between a million and a billion and a trillion?
Yeah, I couldn't recite it, but it's essentially like, because people were saying we can't relate to those large numbers, so,
Right.
but we're used to time, and so if we break it down into seconds,
Right.
Now I'll butcher this, but it's something like if you go back
A
in
million's
time,
like what 10 minutes ago or something.
I think it's like 10 days ago. So like a million seconds ends up being like 10,
Okay.
10 days ago, or 12,
Like 10 minutes.
12 days
I'm
ago.
like of no help. This is
so
terrible.
60 seconds times. So 600 seconds ago was a million.
1 million.
No, but I think it's a couple weeks, right? And then what happens is if you go from a million to a billion,
I got to Google it.
it goes back to the 70s. And then if you
Then it goes back to like 30,000 years ago.
yes, it goes back a
That's right.
long time
That's right.
ago. And so like if you think, the way that my brain works, I think most people's brain would work this way. If someone told you, hey, a million seconds ago was 12 days ago or 11 days ago, whatever
Right.
it ends up being, how much is a billion seconds ago? And you'd be
Right.
like, well, probably like 10 years
Right.
or like 20 years or 30
Right.
years or something more than the
Sure.
original. And it's not what it is. It's 1,000 times that.
That's right.
It's 1,000 times that. And then you have to 1,000 times that again. And so now we're at a trillion.
Right.
So these are incredible numbers.
Here's the whole thing, though. That now, I mean, I'm very, very moderate. I'm conservative in some ways and very liberal in some ways, but I'm really pretty doggone close to the middle.
Sure.
And could swing either way depending upon what the subject is. However, I do know health insurance
Right.
just from being in the employee benefit industry for as long as I have been. And when you start talking about numbers of $50 trillion, first of all, that number I think is over like 10 years.
That
And
is
so, okay. So we're only talking $5 trillion a year. So it's still a lot of money, right? However, what we're not really thinking about is like you have health insurance, right? I have health insurance. The company pays for that. I pay some too. And so the whole thought is there going to be a middle class tax increase? And it's like, ultimately, who's going to pay? You're already paying for this stuff. You're not going to be paying, so if you're paying a little bit more, I'm not saying I'm for it. I'm just saying, let's talk about what's real. Let's not get into the junk of, what are you? Are you a Democrat? Are you a Republican or whatever? I do think it's an opportunity to have a conversation about it. I mean, it works pretty well for 65-year-olds. It works well for my mom.
Yep.
Now, I'm not saying that I want it again, but it really isn't 50-something million. It's or 50 trillion, 52 trillion. It's going to be 5 trillion or so a year. And so you go, well, that's a damn ton of money. Well, it's true. But what are the employers actually paying already? And so they're paying a lot of that, if not more than that right now. And guess what? Employees are putting contributions towards that as well. So they're already paying. And so whether you call an employee contribution towards a medical plan, whether you call it a middle class tax increase, the whole tax increase, though, has got this stigma. Now, what I'm not saying, though, if you give the government that amount of money, they're going to know what the hell to do with it. I am not saying that.
Sure.
Because they historically don't. I mean, I am an economist. I have an undergraduate degree in economics. So I do not believe that they put the resources in the right spots. But that doesn't necessarily mean that it's a bad idea.
Right.
I think it's more complicated than that.
Yeah. So Bernie Sanders